Welcome to Bountiful Spinal Care. My name is Dr. Clint Grover, and I'm going to introduce to you today a different way of doing chiropractic. It's very gentle and very effective, and there's no drugs or surgery involved with it. So welcome to my office. This is where people start out in our office, and we try to make a very relaxed atmosphere, and if you decide to come on a tour in person, we'd be more than happy to have you come. So let's head on back here. And I'm going to show you a couple parts of our office. This is the main adjusting room that we use, and one of the unique things about the type of chiropractic that I do is it's called NUCCA, and NUCCA stands for the National Upper Cervical Chiropractic Association. Upper cervical is a special part of your neck right under the skull. And one of the unique things about the adjustment is you lay on your side versus on your stomach or on your back. And that's what this table is for. So this is where the head is. It's not scary. It doesn't hurt at all. There's no twisting or popping or cracking. But it's very important, and I'm going to show you a couple things throughout my office to help you understand a little bit more about NUCCA and about chiropractic care and how it can help your overall health. One of my favorite things is my skeleton George. And George has 206 bones. A few of his are fused. A lot of times people think of a chiropractor as a bone cracker. And while all the joints in your body are really important, we mostly care about the nerves that go through the bones. The nerves is what controls your health, and it controls the repair, the rebuild, and also protects you from the environmental issues like microbes and illnesses and sicknesses. So it's really important and critical for you to have the nerve signals from your brain getting out to the rest of the spine and out to the rest of your body. So I like having George here because he can show us all the different areas. Let's go and show you the next room in my office, which is the X-ray room. So we are very particular about how we do X-ray, and this is a little bit of a skinny room, but we do a direct digital X-ray, so it all goes straight to the computer. And we can do an analysis on the computer to find out how the bones are misaligned, and then we calculate a specific way to correct those and basically remove pressure on the nerves so that the bones are lined up again. And we have a laser aligned X-ray room, and then in the back here is where our computer is and the different X-rays. I think I didn't get one up. Anyways, it all goes on the computer. And then also I like to show people where they've been, where they're going, and outline the best way that they can get the best results, if this is something that's for you. This shows degenerative changes that happen with the spine, and arthritis is something that's going to cause pain eventually. It's not going to function the way that it's supposed to. A lot of times it starts out from accidents or injuries, and it tears loose the connective tissue in the spine. When the connective tissue gets torn loose, then your spine will lock. I like to show that with this model, which is the back of the head. And if you look inside the head, you can see where the spinal cord would go down through the middle of the spinal cord. Now what happens a lot of times that I'll find is that there's rotation or twisting to the side, and the space of that hole is less. So then the nerves end up having some sort of pressure on them, and your body the neck will straighten out down below to decrease further injury to the spinal cord. Now if we can do a specific adjustment and get it back straight, then that space is opened up and your body can send the signals that it needs to that's vital for your body to heal and be healthy. So that's what we do in the X-ray. It's a very important part. Now I'm going to show you also my room up to the front. So come on with me. Back up through the front area here. I've got a picture to show you. This tells a little bit about what happens neurologically. And when the head is tilted, you're going to end up with signals that are altered, and they're not going to be the same. And the reason is from mechanical pressure, compression. So here's the spinal cord, and if one side has extra pressure on it from that rotation that I showed you, then there could be issues throughout the whole body. Sometimes it manifests like a headache. So if you've ever had a headache, this may be one of the causes. It also causes neck pain, and those signals go clear down to the hips. So let me show you how that works. Okay, so this is my office. A little narrow sometimes. And what I'll do in here, first off, with a new patient that is having some sort of pain, whether it be low back pain, shoulder pain, sometimes numbness or tingling in the fingers, is we'll want to find out exactly what's going on, which nerves are being affected, how does it impact the activities throughout your day that you would like to do, and things that you can't do that you used to do. One of my goals is to help you to be able to do those activities again. And I see a lot of times this imbalance that I was talking about. So this is a picture of a body imbalance, and what happens, I showed you some of those bones up in the neck, and the cervical spine is in the neck, and the very top one is called the atlas bone. So if the atlas bone is twisted, you're going to end up with a whole body effect, and it's because the nerve signals are not the same. What usually happens is one leg will be shorter. In fact, if one leg is shorter and you stand on that hip, the hip will usually drop down. And then your shoulders will go the other way, and your head will go this way, and then you end up all kinked. And that all can happen from a very small misalignment at the very top of the neck, from those imbalanced signals. With the NUCCA adjustment, we do the x-ray analysis so that we can figure out exactly how to restore your body to a straight frame so that the nerve signals can function. A couple of really important things that I check in determining that would be the leg length, and you simply lay on your back and we'll check to see if the legs are straight. And you have to be lined up properly. You can always try it at home if you want to, but we'll see how that works for you. It's not too hard to do. Another thing that I'll do is check the weight balance. So right here, this is really important, where you can put one foot on each side, and it'll take a measurement of each side. Now what's supposed to happen is you should be within 3 pounds or less. That would show an equal balance of your body posture. It's really important to have that balance. If you're 10 pounds off, or 30 or 40 pounds is even worse, then your body is going to be taking a lot of extra wear and tear. I like to think of it like you're with your feet. You're going to get extra wear and tear on one side, that heavy side. So how long can your body really sustain that? Not too long, until the pain shows up and it starts breaking down other parts of your body as well. Okay, so I've explained a little bit about what NUCCA is. Just to recap really quick, with chiropractic we're trying to balance the nervous system so that your body can heal itself. You're not going to get health out of drugs or surgery. It is important to have good nutrition, but health comes from up there, and it goes through the signals from your brain out to every single cell in your body. And I know that always works. When we can get the pressure off of the nerves so that the signals can actually get where they're supposed to, then your body can start healing and it can get back to where you want to be. When you fix the structure, then the function will come, and then you can have the quality of life that you want. Here at Bountiful Spinal Care, I'm here to answer any questions that you might have, whether it be about headaches or neck pain or other weird things like you have a sprained ankle even, or you have elbow pain from overuse or lack of use. And through the chiropractic process, we're able to help the body restore that function on its own in a natural, holistic way. I would like to make an offer too, if anybody is interested in finding out a little bit more about NUCCA. I'd be happy to describe some more in-depth things. And for participants that are viewing this video, you can call our office and receive a free consultation. Absolutely no charge or obligation, to find out if it's something that would qualify and something that would help you or your family members or somebody that you know. And all you'd have to do is call our office and schedule and say, I'd like to take you up on one of those free evaluations. And through that process, my family has had a significant increase in the health. I've had people that have had better luck getting back into sports, better better lifestyle of getting rid of headaches, dealing with disc bulges, and again, the list goes on and on and on. And that's one of the powers of chiropractic. When your body is functioning the way that it's supposed to, then it's going to function the way that you tell it to, not the way the Tylenol or the ibuprofen tells you to. And you know, those are always options, but I like to go with the natural version because I've seen the benefits of it. So, I'm happy to answer any questions, and thank you for joining me.